Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk a little bit today about CBD or CBD oil, cannabidiol. CBD oil, can be derived from the marijuana plant, or it can be derived from the hemp plant. It does not have THC in it. THC is the ingredient that causes one to get high. So this does not have that in it. So it doesn't cause you to get high, but it is used for pain control. In many people, it can be used as a rub to help control pain. In children, it may help control seizures. It may help reduce anxiety. But today, I want to talk about the possible role of CBD in the mouth, in oral health, and specifically on your gum tissue. So there was a study using rats. What they did was they induced gum disease or periodontal disease in these rats by using certain kinds of wires that irritate the gum tissue. And these rats were given CBD. Actually, there were two groups of rats, a control group that did not receive the CBD and the experimental group that did receive the CBD. Now, the CBD was given in the form of injection. And of course, when you brush your teeth, you're not going to be injecting CBD. They found that at the end of the trial period, the rats that had been given the CBD had much less bone destruction, they healed much faster, and their gums were much healthier relative to the rats in the control group that did not receive the CBD. So CBD, by the way, CBD is now a buzzword. You can hear it everywhere, and you're going to hear even more about it because a lot of people think it's the Holy Grail. Well, it's not the Holy Grail, but it may be helpful in certain situations, and maybe it's even helpful in the mouth. It does tend to reduce inflammation. It doesn't kill bacteria. So there are some toothpaste, some very strong toothpaste that have antibacterial agents in them, and those antibacterial agents kill most or all of the bacteria in the mouth, even the good ones. On the other hand, there are now toothpastes that have CBD incorporated in the toothpaste, and these do not destroy the good bacteria, but they enable the good bacteria to proliferate and continue to grow and minimize the harm of the bad bacteria. Also, a great role for CBD is it does reduce anxiety, and so it might be very helpful for patients to take some CBD oil, something with CBD before a dental appointment to reduce their anxiety. Of course, in our dental office, there's no anxiety because we never cause any patients any pain. But basically, if one has anxiety, it does tend to help reduce anxiety, and it's very effective for that. In a future video, I want to talk more about CBD, and specifically, I want to talk about marijuana and actually smoking marijuana, because as opposed to CBD or CBD oil, which could have a therapeutic role, I think the jury is still out a bit on it. Marijuana and the smoke actually is probably and is harmful to the gum tissue because the smoke tends to dry out the gum tissue and may reduce the blood supply to the gum tissue. So there's a big difference between smoking marijuana, which has THC typically, and CBD, which doesn't. So I'm going to talk more about these subjects, marijuana, CBD, in the future, but I just wanted to give you a glimpse of potentially what may be going on now. And I want to remind you to keep your mouth healthy, because if your mouth is healthy, I guarantee your body will be healthier. Subscribe to our YouTube channel. We'd love to hear from you, and have a great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.